And to begin our conversation on COVID-19 and matters arising, we have here in the studio the Honorable Minister of Information and Culture, Alhaji Mohammed. Welcome, Honorable Minister.
Thank you. Good morning.
Good morning, sir.
Thank you.
Let's get started by sounding a little bit pessimistic and negative somehow, given the fact that there is a spike now in COVID-19 cases in Nigeria. And a lot of Nigerians seem to be, not caring so much about non-pharmaceutical, measures. And just recently, and just some moments ago, we read about the suspension of the, the rollout of the COVID-19 vaccines and the National Association of Resident Doctors strike. All these happen to be on the table for the government, and it's really worrisome. How so worrisome is this?
Thank you for having me here this morning. The truth of the matter is that Nigeria is today officially in the third wave of the COVID-19. When it's third wave of COVID-19, because there's been an increase in COVID-19 cases in the last couple of weeks. As a matter of fact, as from July, we've been witnessing increase in COVID-19 cases in states like Lagos, Akwa Ibom, Oyo, Rivers, Kaduna, Plateau, and Kano State. Unfortunately, too, the global situation is not better at all. Since July, we've also witnessed an increase week by week globally of the COVID-19 infections. As a matter of fact, we've witnessed about 4 million global infection figure in the last week alone. And when you compare this to what the situation was the previous week, you see a marked improvement. Today, globally, we are witnessing about 570,000 daily cases, as opposed to slightly over 540,000 just a week before. So we're in a situation today where we have about almost 200 million cases that, worldwide, and almost about 4.2 million deaths. We're witnessing almost 64,000 deaths, on a weekly basis. So really, this is a time for Nigerians and the entire world to take very seriously the non-pharmaceutical intervention. I think the case today has also been worsened by the Delta variant of the COVID-19. And unfortunately, again, this variant has been confirmed in several states in Nigeria. And the terrible thing about this, variant is that it's about 60 times more potent than the wild variant of COVID-2. Not that alone, is more easily transmissible, is very virulent, and is deadly. This, I think, really causes for concern. And really, the recent increase, even in Nigeria, in the COVID-19 cases is directly probably attributable to the Delta variant of COVID-19, especially those who have imported them and circulated them, and those who have come from what we call high-risk countries and their contacts. And this is why one of the things the Presidential Steering Committee has done is to review globally the risk, importation of this, variant. And we have classified some countries as restricted countries. These countries today are Turkey, South Africa, India, and Brazil. Now, it's important to understand the travel protocol around these particular 4 countries, which I've mentioned, which today we call restricted countries. It is not a final list, and we will not hesitate to add to that list any country that we think is, a high-risk country. And the travel protocol around these 4 countries is that no citizens of those countries can enter Nigeria except those of them who are diplomats, those who are coming for high-level meeting with government, or those who are coming with, for, very critical economic engagements. So otherwise, if you're a citizen from any of those countries and you are coming directly into Nigeria, you're not allowed.
All right, sir. I'm not pausing you. Just to continue the conversation from where you stopped. You said Turkey, South Africa, India, Brazil are the restricted countries at the moment.
Yes.
But these are basically countries where you have many Nigerians residing in. And they also make trips to and fro, Nigeria as well. Yeah. With respect to the protocol you talked about, it does appear that some authorities have relaxed this protocol at the airport. And to take this on as well with it, some states, Nigeria, may have or look as if they have relaxed the measures, being taken initially, to curb the spread of this virus. Now that we have, the Delta, variant of the virus, it becomes more dangerous. So what is the PLC doing to ensure that we'll, reactivate those measures?
Yes, Kiran, see, let me first address the issue of Nigerians living in Turkey, living in South Africa, Brazil, and India. Because they are Nigerians, we cannot prevent them from coming home. Just like if a Turkish national or a Brazilian has a resident permit in Nigeria, we will allow him. But they must follow strict, travel protocol, which means when they arrive in Nigeria, they'll have to spend a mandatory 7 days, in a government-supervised quarantine. And when they get there, they'll be monitored closely. They'll be tested day 2. They'll be tested day 7 before they are released to go and continue their businesses. I'm talking about Nigerians. I've said ab initio, nationals from those countries cannot come directly from those countries. But unless if you could leave Brazil, go to Ghana, spend at least 14 days, and then come from Ghana. Okay, yes, that's okay. But coming straight from Brazil or India or Turkey or South Africa without those qualifications, you cannot enter Nigeria. But for Nigerians who are coming in, they will have to spend 7 days. Not self-isolation, no. They have to be in a government-supervised quarantine and facility. And they will not be tested day 2. They will be tested day 7. It's only when they now test negative at day 7 that will be allowed to enter the country. Now, the second issue is that you raised the issue that some state governments and probably are not taking or some, are not taking this non-pharmaceutical intervention seriously. The truth of the matter is that the whole of the country is not taking it seriously, which is very sad. Very sad in the sense that as of today, we've only vaccinated less than 2% of the population. That's a long cry from the 70% vaccination that we need to achieve herd immunity. So this is why, even if you have taken your 2 doses, it does not prevent you. I mean, it doesn't mean that because you have taken the 2 doses, you can walk about without your mask, without washing your hands, without keeping social distancing. Because if you do that, you are still vulnerable to transmit. You can still be infected, but then you will not be seriously sick, and you will not likely die. You might not even be hospitalized, but especially if it's the Delta variant, you'll be able to transmit it even faster. Because you presume you are safe. And this is why we're a bit worried and concerned about this vaccine passport policy. I'll come to that later. But to come back to your question, what is the PSC doing? We've actually, especially with we'll be able to identify the Delta variant in several states in Nigeria. And because it is a very deadly variant, it kills, it's virulent, it spreads faster. We've met with the leadership of these state governments, and we've advised them that they need to reinforce their surveillance system. They need to ramp up their testing. They need to reopen their isolation centers. In addition, they need to invest more in advocacy of not violating the MPI. And more importantly, of course, there will be the need for risk communication and community collaboration. Because we now need more community volunteers and more experts in intensive care, sector of the medicine, because the Delta variant is here, is real, and it's in Nigeria.
Okay.
And frankly speaking, with the low level of vaccination in Nigeria today, we all need to keep more, to abide more seriously with the MPI. Again, most Nigerians, even when they do not come from the non-restricted, from where they come from, because I said countries like Turkey, Brazil, India, and South Africa are restricted countries. But even countries that are not restricted there's also a travel protocol around those countries. If you come, for instance, today from the UK, from the US, from Ghana, the travel protocol is for you to be in self-isolation for 7 days and do a test at the end of the 7th day before you are admitted to society.
Yeah, Honorable Minister, that's a good protocol, but it seems as if we may not really want to beat the dead horse because the Delta variant is already here, it has come in. So let's now try to address how to, approach it and then stop it from spreading. There are indications that, a lot of people escape quarantine really from the airports and as they come in. And the proliferation and the spread of this Delta variant may be attributed to this. Had that been stopped from the beginning, we may not have it right now, but since it is here, and then you're really, stressing the fact that the travel protocol is in place. how do we get the states and the people of Nigeria understand that this protocol is not meant for government to enforce alone, but for public also to monitor? We have relations, we have people from outside that come in, and when you say they should stay in a hotel, government supervised quarantine, it seems the relations are aware of that. But sometimes they don't care about that and they just allow, he's been out for a year or two, we are happy he's back, and handshakes and the rest of all these non-pharmaceutical measures, seem to be thrown to the dogs.
I agree 100% with you, and that's our problem. Even those who are coming from non-restricted countries, when they come, even in their so-called self-isolation, they invite friends and families. And this is dangerous. That is why we are reinforcing our risk communication, team to continue to draw me to Nigerians that the danger of violating or not obeying these MPI is that we're endangering the whole nation. We're endangering our relations, our friends, and as rightly said, the PSC cannot be in everybody's house to see whether truly or not you are, obeying the MPI, the travel protocol. I know that we need it because the ideal thing is for us to be able to monitor you, even your self-isolation, to say, where are you? What are you doing? But in Nigeria, we embark on that, but Nigerians are a bit too resourceful. And they have a way of beating us to it, but we will not give up. And this is why we are asking for better collaboration with all the states and local government. Because at the end of the day, not everybody that comes in, will do is a quarantine, in Abuja. Depending on which airport you come from. If you come in from Lagos, for instance, you have to do your quarantine because if you're coming from Kano and things like that. So we actually need more collaboration with the states.
All right, Honorable Minister, the first set of vaccine that were administered on Nigerians was AstraZeneca.
Yeah.
And at the moment, we have the Moderna vaccines, which have arrived, let's say about 4,080,000 doses. Yeah. Now, can you tell us more about this particular vaccine and what's the difference between Moderna and AstraZeneca? And how will you convince Nigerians, most of whom are even hesitant in terms of taking the jabs in the first place, to take this one, which is new to Nigeria?
I think I want to take the opportunity to thank Nigerians for the way they responded to the first batch of the AstraZeneca, vaccine. I can say authoritatively that we succeeded in administering the first batch, the 4 million doses of AstraZeneca, and we do not have one single expired, vaccine. They were all, administered to the targeted, population. And I want to encourage Nigerians to please come out also to take the Moderna vaccine. In terms of differences between Moderna and AstraZeneca, I don't think there's much. Of course, I'm not a scientist, in the sense that both vaccines, you need 2 doses. But in the case of Moderna vaccine, you need to take the 2 within a 4-week interval. And then it has between 72% to 95%, efficiency. Yes, we are right, we received about 4 million of such, actually 4,080,000 doses. We would commence the administration of, to administer these doses next week, Monday. And this time around, we're going to target people who are 18 and above. Because incidentally, in the US in particular today, the younger ones are now becoming more vulnerable to attack and to infection.
But I'm not cutting you short, Honorable Minister. The Daily Trust is reporting right away that the federal government postpones COVID-19 vaccination. It's doubts donated doses. What would you say about this?
Well, I want to hear that again, sir.
FG, federal government postpones COVID-19 vaccination. It's doubts donated doses, which means it's been suspended.
No.
The PSC announced this yesterday.
You see, we suspended it till Monday. It was supposed to be launched tomorrow.
Right.
But then, you see, when vaccines arrive, they are taken to NAFDAC. NAFDAC will analyze it, and NAFDAC will give us the green light. It's purely administrative.
Okay.
That is what is happening. And you see, this is the problem. You see, after the pandemic, the infodemic is another problem that the PSC is fighting, which is the fake news around the vaccine, which is the vaccine hesitancy. There are so many, people who are being misinformed about the potency or safety of these vaccines. For instance, they first came up and said there's what is called magnetic effect if you take the vaccine. After that, they said it's actually meant to depopulate certain parts of the country, but it's not true. Every vaccine in use today has been proven to be safe. It has been proven also to save lives. Okay. And so the risk communication pillar of the Presidential Steering Committee on COVID-19 and the vaccine demand generation arm of the National Health Delivery Agency, we're all working together to fight this fake news, and we're enlisting the support of religious leaders, community leaders, the media, influential people to fight this disinformation, to fight this fake news. If these vaccines are not safe, they will not be administered.
Okay.
And it has been found also, not only are they safe, they actually do save lives.
Okay.
Like I explained at the beginning, if you have your 2 doses, at least something is clear. Even if you catch, COVID-19 again, it will be very mild. You will not be hospitalized, talk less of dying. As opposed to the fellow who has not taken any vaccine.
Okay.
So we must encourage, people to go out and take the vaccine.
Okay. But Honorable Minister, Minister, what is also worrisome is the fact that some influential persons are the purveyors of this fake news concerning the vaccines. You see, leaders of churches, people who have followers, come on social media to really, put down the vaccine. And it's so worrisome because many are believing their pastors, for instance. The pastor cannot tell us lies and all that. That is one. How do we now checkmate such individuals? That's one. Another is the fact that it has become so difficult to track down violators of the travel protocol. And that is another dangerous aspect of these variants we are talking about. Yeah. Because personally, I know persons who came back from UK, they had to do burials and all of that. They find themselves in the villages without even form of quarantine. So why is it difficult to track them down? Or have we, at some point, relaxed this protocol thing by those persons who are in charge at the port of entry?
Yeah, you see, I agree with you that otherwise responsible people have been found to be behind this fake news about vaccines. Some do it for very selfish reasons. Some do it out of ignorance. But if it's any comfort, it's not just in Nigeria. It's everywhere in the US, in the UK, in China, everywhere in the world. There are some people who are simply bent for whatever reasons to disinform and pass this fake news and say no, and say that you don't need the vaccine. What we do in Nigeria, especially with the presidential steering committee, is that we are driven by science, not by conjunction. Sorry, not by conjectures. We are driven by science. And we know that it is true that it's COVID-19. It's true, it kills. I came from Lagos yesterday, and a very influential Nigerian sat by me, and we were just talking. He said he was number 7 in the list of people that caught COVID in Nigeria and got admitted to isolation center. That he was there for 21 days. That he never knew he would survive it. That he was always fearful when night came, because he never knew whether he would see morning. That for 21 days, he did not even know where he was. And I tried to encourage him to please be our advocate, because he's very high-ranking. He's a politically exposed person, and people like that can come out. I think it will be more believable. It will be more believable. As to how do we track violators, we need everybody's support. You see, it's very easy. It's very easy to know who's a violator. A man comes back from the UK or from Russia, and the next day you see me in the market. Next day you see me in the supermarket. Next day you should not be. I mean, you should be courageous enough to report him to the authorities. But unfortunately, we don't have that kind of cooperation from Nigerians. But it's important, because you are not being a traitor. No, you are saving yourself, you are saving your loved ones, and you are saving society.
But it so seems, Honorable Minister, that at the point of entry, that is where Nigerians are looking at. The authorities, the feeling in the public is that the authorities should be so serious and stringent at the points of entry and ensure that these protocols are abided by. That is one. Number two, I want you to really comment on the pressure now that is being brought on this very issue of COVID-19 by the residents' doctors' strike, which started on Monday. And it seems as if there is no sign of abating inside, given the stance of the two parties. Now, these are two great issues that really needs to be addressed and then approached in a very serious way in order to curb the spread of COVID-19.
Yes, you see, the first one, like I explained to you, sir, there are two. We have ranked countries into two. Countries of concern, which we have said restricted, which we call it restricted countries, and then countries which are not restricted, but nonetheless, where we have to monitor, people coming from there. Now, for countries that are restricted, here we have taken a very bold decision that nobody from those countries will come in except these exemptions I gave earlier on. So, which means it's only Nigerians from those countries now that will have to do, compulsory, quarantine, plus those of them that come from those countries that have been exempted. Now, but the majority of our problem are those who are coming from non-restricted countries, who we cannot detain at the airport, who we cannot take to government supervised quarantine facility, but who we trust will go home and self-isolate. This is these are a major headache. They come in and the next day they are in the offices. They hardly go on self-isolation. Neither do they go for the mandatory 7th-day test. They just make with society. So, frankly speaking, we need everybody's support.
And why can't such be brought under the real restriction now?
Pardon?
Instead of having to just limit it to those countries that are really high risk, and then allowing Nigerians from other countries to be coming in and then take it onto themselves to do it. They are not doing it.
You want us to put everybody in quarantine?
I mean, not everybody that comes in should follow the
No,
protocol and then
I agree with
not
you,
be
see,
allowed to go home and then feel he can. See, they are not doing
you
it.
see, what that will mean is that everybody who travels from anywhere in the world and comes to Nigeria today would have to be quarantined. They are not even in public quarantine facilities to take everybody. No, there are those practical challenges. And plus, the global practice, what we are doing. But we need to appeal to our people, more to cooperate with us. And as to the
That's right.
Yeah, it's not only just complicating the COVID-19 issue. It is complicating the entire health issue in the country, and we can only hope for a quick resolution to the problem.
All right, Honorable Minister, well, our time with you is actually up, but let's get your last words for Nigeria. And added to that is the fact that the federal government awarded contracts, for rehabilitation of oxygen plants in 36 states of the country. Has that been done?
I would have to check from the Honorable Minister of Health what is the progress on that. But I know that it's true that the Federal Council, approved the memo brought by the Ministry of Health to ensure that we rehabilitate, the oxygen center in not just all the 36, I think about 43 of them. But only the Minister of Health can actually tell us the status of this particular country. But my advice to Nigerians, my last word, please, COVID-19 is real. And it's about science. It's not about opinions. The Delta variant is virulent, is 60% more potent than the other variants. It is easily transmissible and it kills fast. Nigerians should please not take the non-pharmaceutical intervention protocol lightly, because in a country that has not vaccinated 2% of its population, they cannot claim herd immunity. You need 70% vaccination to get to that level. You look at the gap between 2% and 70%. So please, we would appeal to Nigerians, because they are not just endangering themselves, their family and everybody. And when you look at today, I was listening to the CNN news. Over 100,000 cases have been reported in the US daily, as we speak today. And when you look at the consequences of COVID-19 on our health structure, on our health infrastructure, on our economy, it's better to prevent it. And all you need, wear your mask when you're in public, wash your hands with water and soap. If you have sanitizer, use your sanitizer. Avoid, mass gathering. Use your face mask. But regrettably, Nigerians were behaving as if we are
Nothing has happened.
On a final note, Honorable Minister, do we see the possibility of reverting to enforcing the non-pharmaceutical measures as we did in the first and second waves in such a way that people should now feel as if they should be forced now, because it's an attitudinal thing. It doesn't really now affect one person or two persons. It has moved from individual to community spread now. Do we see that inside if this attitude continues among Nigerians?
Now, honestly, my appeal would be to state governments and local governments. It's achievable. Okay. If you make wearing of mask compulsory and the condition precedent to transacting business at all levels. You want to go to the hospital, wear your mask. You want to go to the market, local government chairman, tell them if you don't you wear your mask, you know, you don't enter. You want to go and renew your driving license, you must wear your mask. You want to go and get your tax clearance, wear your mask. You want to even go and look for wear your mask. If we insist on that, it will go a long way in, you know, preventing infection.
All right, Honorable Minister of Information and Culture, I would like to thank you for your time, and of course I appreciate your contribution to this very important conversation. I would like to also appreciate all the efforts you are making. Of course, you're a member of the PSC. Let's see what happens from now on, that we have already itemized some of the issues surrounding this, the third wave of COVID-19 in Nigeria. Thank you so much for coming.
Great, a pleasure always to be here. Thank you very much.
All right, you're watching Good Morning Nigeria, reaching you live on the network service of the NTA. We'll take a short break now. When we come back, we'll continue with the conversation on COVID-19 and matters arising. This time around, we're going to be talking to professionals in the field. Stay with us.